It again.
Hi everybody. So today we're going to talk about how to weigh sponges in your rooms. So the first thing you want to do is you want to get your scale out, and you need to find a plastic container, any kind of disposable container. These are the containers from the packs in eyeballs that we use. There's lots that we keep outside of room 6 on top of the Pyxis fridge. If not, some rooms come with containers like this, like in room 18 or cardiac, that have a plastic bin that come with all your supplies. So you can use that. So the first thing you want to do is you want to put it on the scale, and then you want to get a pack of sponges. So whether you're using 12s or 18s, you want to make sure you have a full pack and place it on the scale. So that's zeroing the scale. So then you want to make sure that your dial is at 0. So here we're at 0 grams under the red. Okay, so now when you take the sponges off, it'll say something similar to this. It's empty, that's 0, because it's not counting the weight of the container. So now when you go to add dirty sponges, let's say these are dirty, you're gonna add them one at a time. Make sure the string is sticking out so you can visually see that there's however many you have. So 1, 2, 3, 4, and 5, and now these aren't actually dirty, so the scale's not moving. However, you want to make sure you can visually see all of your strings, and then you can count them off with your scrub nurse and do with them what you will, whether you want to cross them off your count sheet, put them in the sponge counter. It's up to you. You have to decide as a group what you want to do. So that's how you would zero, and you want to make sure when you're looking, the scale's in grams, but we're considering blood loss 1-to-1, so 50 grams would be 50 milliliters of blood loss.
Thanks, Caitlin. Over here we have another option for scale in some of our ORs. We've got the electronic scale. Right now this one lives in OR1. So to do this, it's the same principles. You basically just turn the scale on here. It says 0 grams, but we want to tare it as well. So we're going to place a disposable tray like the one Caitlin used from our ophthalmology room. And then I'm just going to take my opened and unwrapped clean sponges to tare. So we can see that all of this weighs it currently like 159 grams, but I'm gonna hit tare and set, and that's gonna hold this and remind the scale that this weight is starting at 0, so that then when we do add dirty sponges, we'll consider these dirty. It's a little harder to have the tails folding off nicely on here, but it's the same consideration to have the tails, the strings all visible so that you know that you in fact have 5 on there. You don't want any weight weighing on the scale either. So there we go, 1, 2, 3, 4, 5. So because we'll pretend these were dirty, so it's showing 38 grams right there. So that's about 38 cc's of blood loss. And it's only showing that because these sponges are bigger than the ones I tore, but that's okay. So I hope that clears up some confusion that some staff may have about weighing sponges to approximate your blood loss, but you gotta tare your open sponge pack in the same size that you're using, like Caitlin said. Then you are going to start weighing them, and it's a 1-to-1 ratio. So 1 gram is going to be 1 milliliter blood loss. Thanks, guys.